colored pre and post central gyrus, you kind of have to look for where would the central sulcus be. And this is the central sulcus here. And so then from here you would have the precentral gyrus, and then that's the central gyrus. So then that tells you the lobe. So you got frontal lobe, parietal lobe, and then occipital lobe is deep in here. So when you see it in the head, you realize how far down is the occipital. And your temporal would be there. So if we pull this out, you can see the white matter versus the gray matter. There's the olfactory tract and the olfactory bulb. Corpus callosum, septum pellucidum. And then where this blood vessel is, that's your cingulate gyrus. And that's where you do the limbic system. It's tied into the limbic system. Now, this is the insula. And the insula is behind the temporal lobe. So when you pull this out like this, you can see the temporal lobe. Then you would have to peel it back to see it. So there's the insula right there. These gaps right here are gaps for the lateral ventricles. And then this right there is your choroid plexus, is there, and that's the choroid that is for the lateral ventricles. Now you see that choroid right there, that's the choroid for the third ventricle.
Oh,
so the third ventricle is kind of like in the middle here. This is your diencephalon, this is your basal ganglia. So when you pull that out, on one side you have the insula, on the other side you have the caudate nucleus. And then there's your diencephalon. So this is the fornix, diencephalon. This is the thalamus and the intermediate mass of the thalamus. This is your hypothalamus. This is the epithalamus, and then there's the pineal gland. So when you look back here, this is your corpora quadrigemina. So you've got like this, you have the superior and inferior colliculi, and there's the pineal gland. So this little dip right here is where the fourth ventricle would be. And on this side, you have the optic chiasma. This is the midbrain. And on the front, those are called the cerebral peduncles. Over here, you can kind of see the optic projections. You know how you have the optic tract? And then the, not the projections, but it's the pathway that leads to your geniculate. So this is where the geniculate would be.
The thalamus.
And then you have the pons and the medulla oblongata, and then there's the olives, which are pink right there. And then the pyramids are where you do the decussation. You can kind of see the bulging. So you have your pyramids right there. So.